A study conducted by Kronos Incorporated in 2017 reported that 98% of hospital nurses report their work is physically and mentally demanding. 63% said their work resulted in burnout. That was in 2017. Fast forward to 2020. The physical and mental demand on nurses is extraordinary. Now they're battling exhaustion and burnout due to COVID-19. You know, when this virus hit, healthcare teams were called upon to save the world, and they did. They made it through. And when cases started to drop, they claimed victory over the virus. However, they didn't realize that the battle had just begun. Before they had a chance to recover and recuperate, they've been called upon yet again. The world went from praising the healthcare team as heroes to now worrying about their physical, mental, and emotional health as this crisis drags on. As COVID-19 cases rise, so do physician and nurse burnout. So on this episode of Coffee and Conversations about Nurse Bullying, we're going to talk about how nurses can beat burnout so they can continue to save the world and themselves. And why are we talking about burnout on our show? It's because when nurses are burned out, they lash out. Hi, I'm Dr. Renee Thompson, the CEO and founder of the Healthy Workforce Institute. Welcome to Coffee and Conversations about Nurse Bullying. You know, before the pandemic, we knew nurses exhibited high rates of burnout. Burnout occurred due to a variety of factors that were just sort of part of the job. The unpredictability of care, life and death situations, increasing demands, decreasing resources. However, wouldn't you agree that there were always breaks in that demand? You had good days with stable patients. Sometimes the unit was quiet and you could get caught up on education, attend committee meetings, and maybe work on projects. Now, there's no break. Nurses have gone from normal burnout to consistent, unrelenting burnout, and now exhaustion. Anyone can handle a crisis when it's short term, not when a crisis becomes the new norm. Here are 2 tips to help you beat burnout. Number 1, adopt an attitude of optimism. Now, optimism isn't someone who lives in a state of constant joy, who walks into work skipping and smiling and never seems to be upset about anything. I mean, that would just be weird. Optimism is the belief that good things are possible. It's being hopeful about the future and confident that no matter what the current situation is, things will get better. There's so much gloom and doom out there right now, and people who are optimistic don't let the media or the break room chronic complainers suck them into the vortex of hopelessness. Instead, they rise above and remember that most people are good people and that there's more goodness in the world than badness. That nursing is a wonderful profession filled with numerous opportunities to make a difference in the lives of millions of people despite the challenges. Number 2, please take care of your physical body. Healthcare professionals are tireless advocates when promoting physical health and well-being to our patients. But did you know that more than 50% of us report our overall health as poor? Think about it. Your body spends energy every single second of every single day just maintaining your body functions. I mean, keeping the pH of your blood between 7.35 and 7.45, bringing oxygen and nutrients to your cells and getting rid of waste products, keeping your heart pumping and your brain processing. Yet many of us sabotage ourselves when it comes to our physical energy and then wonder why we feel so tired and burned out. Well, why do you think that is? It may be because we don't always make taking care of ourselves a priority because we're so busy taking care of everyone else. Here's what I want you to do. It's so simple that it's actually disturbing. Sleep. You need to get more sleep, and you need to eat real foods. Please put down the donuts. We care about your physical, mental, and emotional health, and we really want to hear from you. So let us know how you're doing in the comments below. If you like this video, make sure you subscribe and share it with others. And also, you can access our brand new resource called 5 Unusual Ways to Beat Burnout on our website, healthyworkforceinstitute.com. Resources, free downloads. Until our next conversation, be kind, take care, and stay connected.